A report from the Cleveland Clinic Guide to Liver Disorders identifies the liver as the largest organ in the human body. The liver has many functions, but it mainly focuses on expelling harmful substances from the bloodstream and promoting the breakdown of food. Despite its size, the liver is one of the most disease-susceptible organs. The liver is unable to entirely recover from damage or any illness. The Mayo Clinic suggests that chronic alcohol abuse leads to alcoholic liver disease, which in turn causes damage to the liver. In the final stages of ALD, the liver becomes scarred and its functions grow limited. This process is known as cirrhosis of the liver. While the liver is meant to detoxify your blood from harmful substances, it cannot do this when the organ becomes scarred. The damage created from cirrhosis cannot be undone, but if the scarring is diagnosed at an early period, the Mayo Clinic website states that further damage can be stopped and treatment can extend the life of the liver or allow time to schedule a transplant. I chose the effects of liver disease and cirrhosis of the liver because it is a disease I am familiar with. This past May, my mother was diagnosed with cirrhosis of the liver, the final stage in alcoholic liver disease. In the next several minutes, I hope to help you understand alcoholic liver disease and cirrhosis of the liver, symptoms, fatalities, and inevitably treatments. Since we have covered the definition of cirrhosis, I would like to explain specific causes. In this instance, I am using alcohol abuse as the major cause. There are many other factors other than alcohol abuse, but for the time being, I wish to address this issue singularly. A recent report from the United States National Library of Medicine notes that alcohol enters the bloodstream quickly. Consistent and overconsumption of alcohol causes the liver to work at a faster pace than normal. In turn, this wears the liver down, just as a sponge becomes flimsy and falls apart after multiple uses. This can lead the liver to become scarred and broken down. According to WebMD, cirrhosis progressively blocks the flow of blood with the scar tissue and slows processing of the liver. This causes many complications, such as discolored skin, weakened immune system, and many more symptoms we will discuss in the moments to come. Let's first discuss how liver disease and cirrhosis begins. In addition to the scarring, the liver becomes overworked and confused. T.M. Chen, author of Liver Cirrhosis, New Research, notes that liver disease begins with an injury. In this case of alcoholic liver disease, the liver obtains injury from the amount of the overconsumption of alcohol. This promotes a cascade pathway where hepatic stellate cells, known as vitamin A storing cells, are released. These cells are known for the regulation of homeostasis. Simply put, these cells maintain a harmonic balance. They are released to help fight the damage being done to the liver. However, these cells do secrete proteins, which disrupts the harmony of the chemical balance of the liver itself. In short, these cells are being produced because the brain says they are needed, but the liver disagrees. Now that we have covered the disruption begins, let us move to the next step. The next step is when the patient begins to feel the effects of the alcohol that has placed after persistent abuse on the liver. Typically, patients who notice these symptoms right away schedule many medical appointments, but many wait until it is nearly fatal before seeking help. This is very, very dangerous. Those that seek treatment right away still have quite a large chance of fatality. The liver is one of the most essential organs of the body. While the liver is impaired, it's expected that all other functions of the body will be compromised as well. WebMD says that there are various symptoms, but some that raise the greatest concern are yellowing of skin, sudden weight loss or gain, and itchy skin. Other symptoms include bruises, swelling in the ankles, colored urine, blood in the stool, and confusion or personality changes. After symptoms are noticed, it is best to seek treatment immediately. Doctors will use several medical methods to diagnose the situation. The Cleveland Clinic Guide to Liver Disorders suggests that the CAGE questionnaire, which consists of a series of questions used to determine whether the patient's drinking behavior needs to be further evaluated. Once it is ruled to be an issue with the liver, doctors will conduct blood tests, physical exams, and possibly a computerized tomography, or also known as a CT scan. If further confirmation is necessary, a biopsy may be ordered. This consists of obtaining a tissue sample from either a cheek swab or by using a laparoscope, which is a viewing device that's placed on the liver, inserted into an incision in the abdomen. After the diagnosis is confirmed, treatment can begin. The main and most effective treatment of cirrhosis of the liver is the complete and total cessation of alcoholic consumption. The Guide to Liver Disorders believe that this is the key to stopping any further damage to the liver. Of course, medication and further medical exams may be necessary. Once a commitment to sobriety has been declared, the patient must agree to a strict diet and exercise program. Increasing consumption of foods rich in antioxidants and lowering the intake of iron are a few examples of how serious changes will be needed to put in order to maintain health. For more severe cases, there are medical-based treatments that could be considered as well. A lifetime of doctors' visits and treatments are to be expected for recovering patients of alcoholic liver disease, as well as cirrhosis of the liver. Dealing with life after the scarring of cirrhosis can be difficult, but it is manageable. My mother has completely given up almost 4 decades of abusing alcohol. It's difficult for her every day, and it's always a struggle, but a supportive family and a determined mindset are essential. A healthier lifestyle is obtainable with just a little bit of work. It is clearly evident that alcoholic liver disease is the cause of cirrhosis of the liver, and I hope the facts that I've provided are relevant and informative for you. As one of the most vital organs in the body, the liver is essential in daily bodily functions. When it cannot function properly, as with cirrhosis of the liver, all other components of the system are at risk. Cirrhosis of the liver is the final stage and the beginning of the end of a vital organ, and if not properly treated, life.